Hello, everyone. Hello, beautiful people. Welcome back to my YouTube channel, guys. It's your girl, African Queen, on a radio talk show this morning concerning this coronary virus. I'm just curious about everything. I want to know the update. I have to sign up with CDC in order to give me updates on what is going on concerning this coronary virus, because I want to know exactly how the healthcare professionals are taking care of this, what they are doing to eradicate this, to wipe this off the earth. Like, this is around the world, the whole world. And don't forget that we also need the mercy of God in everything we are doing. Take the necessary precaution, as they said, and pray, and let's move on with life. By the grace of God, this coronavirus will be surely eradicated by the grace of God. So let's move on to the latest news of today. As you can see what I'm watching now, this is CDC EPIC webinar on Wednesday, which is today, March 18th. It's going to take place by 1 p.m. to 2 p.m. and they will be answering necessary questions, up to 20 questions from the health professionals, telling us exactly what we need to know concerning this coronavirus. And if you want to also get this information, you can go to their website and sign up for it. They will send it to your email and let you know the latest update of the day. So let's head on to the next page. This is emergency preparedness and response, and they will be answering 20 questions about the COVID-19. And the international outbreak of COVID-19 poses a serious public health threat. The federal government is working closely with state, local, tribal, and territorial partners, as well as public health partners, to respond to this public health threat. The public health response is multi-layered, with the goal of containing the spread and mitigating the impact of this virus. This special webinar from CDC EPIC will discuss the current state of the outbreak, what the CDC is doing to respond to the outbreak, and how partners, organizations, partners, organization, and the public can help on this particular virus outbreak. So coming down, you will see the webinar participants and the viewers will accomplish the following. They will describe the CDC's role in the topic covered during the presentation. So I think this will be coming up today. As you can see, this is webinar stroke / audio conference call on March 18th, 1 p.m. to 2 p.m. Eastern Time, and it will be on a PowerPoint slide, at least to show people exactly what is going on this. As you can see on the downside of the newsletters and announcement, you can sign up for this EPIC news and also join live to know exactly the updates concerning this coronavirus outbreak. The public health professionals, the administrators, emergency responders, program managers, and satisfied health educators will be present to analyze and address exactly what goes on with this coronavirus. So prepare your health and take the necessary precaution. Right here you will see, this is on this side is the president's coronavirus guideline for America, those in America and also around the world. Let's see what the president said concerning this. Moving to the whitehouse.org, and Let me see what he said. Okay, he said the president's coronavirus guideline for America, 15 days to slow down the spread. Listen to and follow the direction of your state and local authorities. If you feel sick, stay at home. Do not go to work. Contact your medical provider. If your children are sick, keep them at home. Do not send them to school. Contact your medical provider. If someone in your household has tested positive for the coronavirus, keep the entire household at home. Do not go to work. Do not go to school. Contact your medical provider. If you are an older person, stay home and away from other people. If you are a person with a serious underlying health condition that can put you at increased risk, for example, a condition that inspires your lungs or heart functions or weakens your immune system, stay at home and away from other people, and do your part to slow down the spread of coronavirus. This is from the president. President of United States of America, and also the information is from the White House. So I'm going back to the page, also telling you how to protect yourself. You click on this, and this is telling us how it spread. For you to know how this spread, there is currently no vaccine to prevent this. This was said before, but hopefully there must be something that we do to take care of this. I believe that. And they say the best way to prevent illness is to avoid exposure to this virus. The virus is thought to spread mainly from person to person between people who are in close contact with one another and within about 6 feet through respiratory droplet produced when an infected person cough or sneeze. So another thing you should follow, take steps to protect yourself. Clean your hands often. Wash your hand often with soap and water for at least 20 seconds, especially after you have been in public places or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% of alcohol. Cover all surfaces of your hand and rub them together until they feel dry. Guys, make sure you take this necessary precaution, and also don't forget to pray. Avoid contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at higher risk of getting this getting sick, very sick. Actually, maybe old the little kids, elderly people. Then it goes on to tell us, stay at home if you are sick, cover cough and sneezes, wear a face mask if you are sick, clean and disinfect, and also clean and disinfect frequently, touch surfaces. Okay, move on to the let's say the symptoms and the setting, how to manage the anxiety. Let's look into the symptoms. The symptoms is right here. Let's see the symptoms in case. Okay, there is also, okay, call your doctor if you think you have been exposed to COVID-19 and develop a fever and symptoms such as cough or difficult in breathing. When you feel that you cannot get air while you're breathing, you cannot get enough air to breathe. Maybe you kind of hold of breath, then difficult in breathing is what it is. You have to report immediately. The following symptoms may appear 2 to 14 days after exposure. So this is especially fever. When you're running fever, cough, shortness of breath, you have to call the emergency line. I think for You have to call 911 if you're in America. You have to call 911. Then other states or countries, make sure you know the emergency line that you have to call. This is when the fever is too high. You have to use damp towel, like, in water to subside the fever, cover your cough, shortness of breath. This is what it looked like. I don't know if you all are seeing. Let me move it to the right side. And if you develop emergency warning signs for COVID-19, get medical attention immediately. Emergency warnings are difficult in breathing, like I said earlier, shortness of breath, persistent pain or pressure in the chest, new confusions or inability to arouse, bluish lips or face, like maybe you notice your face is turning kind of bluish, or your lips kind of bluish. So what to do if you feel sick? Let's look into that. Steps to help prevent the spread of COVID-19 if you are sick. The same thing I said earlier, stay home except to get medical care. Stay home. People who are mildly ill with COVID-19 are able to recover at home. Do not leave except to get medical care. This is from CDC website. Yes, the Center for Disease Control and Prevention. Yes, guys. As you can see, call doctor ahead before visiting your doctor. And yeah, this is the latest. Let me see. Okay, joining the EPIC mailing list, continuing education. Yes, guys. This is exactly what that is happening right now, is going on right now. Let me see. Yeah, have a look into that. All right, guys, I will talk to you guys later. Let me see exactly informations. Okay, let me move it on the side so you can see coping with the disaster and trauma. Okay, coping with the disaster and trauma. Coping with the disaster, the outbreak of coronary disease, COVID-19, may be stressful for people and communities. Okay. Guys, just take the necessary precautions, and let's pray for each other. Everyone put each other in prayers, and make sure you do the right thing, the necessary precautions, in order to stay away from this COVID-19 outbreak. So yeah, this is the responders tips for taking care of yourself. This is planning resources for health. If you go to the website, you will get all this information. Take care of your emotional health, helping children cope, and planning resources for the state, and tips for taking care of yourself. Let's look at in this tip. Emergency responders tips for taking care of yourself. Responding to the disaster is both rewarding and challenging work. Sources of, yeah, this is for those responding to help people who are in the in the emergency situation. As you can see, they are cleaning everywhere during a response. Understand and identify burnout and secondary traumatic stress. So guys, Let's look into the signs of burnout. Signs of burnout: sadness, depression, apathy, easily frustrated, blaming others, irritability, lack feelings, indifferent, isolation and disconnection from others, poor self-care, hygiene. So all these things, you have to pay closer attention to your loved ones and know exactly what is going on with them and alarm for emergency. Yes, guys, with that being said, I will round it up right here, but don't forget, the if you are interested concerning the live webinar, which I know they have not, is still on the schedule, which will take place by 1 p.m. to 2 p.m. Let me see. So guys, that's it. Thank you so much, guys. Thank you for clicking. Thank you for listening. Protect your family and make sure you take the necessary precautions so that we will get rid of this coronavirus. All right, guys. See you all on my next video. Thank you, guys, and remain blessed. Bye bye.